I'd like to invite Sanya Nishtar of HeartLife to the stage. In many places around the world, the high cost of healthcare and limited access to both health insurance and to credit are prohibitive for families when they face a catastrophic event, or even possibly when a woman is giving birth, to being able to acquire and pay for the care that they and their families need. Reducing the healthcare's reliance on immediate out-of-pocket payments helps protect not only patients and their families, but also the integrity and the reliability of the health system in the future. In 2008, HeartLife and the Rockefeller Foundation committed here at CGI to create an automated payment system designed to protect the poor against catastrophic healthcare costs. And the system, which is now fully launched in Pakistan, allows healthcare workers to use wireless phone technology to automatically transfer cash payments to hospitals and clinics, providing medical treatment to patients in need of immediate urgent care. This commitment has already assisted more than 1,000 people and their families in Pakistan, and has the potential to be rapidly scaled in other emerging and developing economies. Sanya, I hope you'll tell us a little bit more about your commitment and hopefully how we can help scale the work you're doing in the future.
Well, thank you very much. We started with a very small project in 2008. The idea was to protect people from medical impoverishment. And the reason why I started was because one day I was visiting a hospital and there was a man who was on an artificial leg. And I asked what had happened to him, and they said he had suffered from an accident and he didn't have $500 to pay for his treatment. And the resident attending to him very jokingly said that if you go and have your leg amputated, you can not only go back to work much faster than you would if you had a plaster cast on, but you would also be economically productive. And I was just finishing a book which I sent off to the Oxford University Press. And as I went back and I was looking at the proof, I told myself, I'm not going to be a health advocate for the rest of my life. I am going to try and do something about it. And it so happened that I got a call from CGI the same week. I had been to CGI the year before, and it was just a perfect partnership. And subsequent to that, we went on. We started with a very small project. It's now been scaled up nationwide. It's linked up with the country's poverty alleviation program. The technology has been designed for scale up. And it's an innovation which we hope is going to bridge a critical gap in current global efforts to achieve universal coverage for healthcare, because it provides access to financial services for a segment of the population which are in the informal sector. I was very humbled to receive the Global Innovation Award based on this project, which is a heartfelt CGI commitment. And I'm so privileged and pleased to be here with you today.